Healthcare is one of those spaces where innovation is outpacing the regulations. At this point, administrative and clerical burden on providers right now is the worst I've ever seen it. On average, providers are spending up to 2 hours on clerical and administrative work for every single hour of patient care they do. This has nothing to do with the person. And I have so many physician friends and they work so hard. They give it everything. And as hard as they work and as tired as they are, they just keep pushing. And thank goodness for all of us that they do. Their burnout is not a personal problem, it is a systemic problem.
Welcome to the K in Clarity podcast. I'm the host, Mezue. During this episode, we're joined by Monica Courtade, a seasoned health strategist and senior advisor. Monica Courtade has been instrumental in designing tech-forward solutions and fixing operational efficiencies within the healthcare and health technology space. She focuses on bridging profit leaks and access barriers, ensuring organizations develop systems that are both technologically advanced and truly serve patients and providers' real-world needs. With more than 15 years dedicated to healthcare strategy and operational excellence, Courtade partners with startups and high-growth healthcare organizations to drive business transformation, optimize revenue cycle management, and expand equitable access to care. Her expertise spans payer strategy, automation, clinical practice design, and regulatory compliance. Passionate about aligning vision with execution, Monica continues to help companies thrive through data-driven, robust workflows and cross-functional collaboration, positioning her as a thought leader at the intersection of healthcare innovation and patient-centered outcomes. If this is your first time tuning in, here's the gist. The healthcare industry is buzzing with innovations, but there's a lot of noise and misconceptions out there. That's where we come in. Because of my experience in the healthcare ecosystem, I've gained a unique vantage point into the industry's inner workings. We're bringing you the conversations that typically happen behind boardrooms and strategy sessions, the real challenges, innovative solutions, and game-changing insights that are reshaping healthcare as we know it. On this podcast, we're bringing you face-to-face with the industry-leading healthcare founders, executives, and innovators. We're talking about the nitty-gritty of building and scaling healthcare companies, the hurdles they've overcome, and the strategies that have led to their success. More importantly, we dive into the personal challenges that come with trying to change a system as complex as U.S. healthcare. So whether you're a healthcare entrepreneur, a medical professional, or just someone passionate about the future of healthcare, this podcast is your backstage pass to the minds shaping the industry. Now let's have Monica tell us a little bit about themselves. Welcome, Monica, to the K in Clarity podcast. For the people listening, can you give a brief overview of who you are and what it is you do?
Happy to be here. I'm Monica Courtade. I have spent the last 15 years of my life really tackling our healthcare system, all things from services to operations to billing. And I've done so working through several startups along the way. Some really great pioneers that have taught me a lot and really pushed me into the system. And now I don't want to leave. And after 2 successful exits, I am now running my own consulting firm as well as advising for some additional agencies on the side as well, trying to help more practices and small health systems work through some of the challenges that our healthcare system presents.
Well, as you might know, we typically like to do an icebreaker here. And so I thought I would give you an interesting one to make you think, right? And so my question for you is, if you could invite one outsider from any industry or discipline to really help redesign a broken part of the healthcare system, who would it be and what challenge would you give them to solve?
Such a good question. It's something we think about a lot, but when you sit down and really try to look at other leaders and looking at their strengths and weaknesses and trying to match that matrix up against what healthcare really needs right now, I think sort of looking at people who have mastered data logistics is really important. I think one of the biggest challenges of our current healthcare system is the fragmented data structure. It's the inability for all of these different parties in healthcare to share information, share alike in a safe way. Creates a lot of inefficiencies. And so I think really looking at a pioneer of someone who's done that well through the lens of Tony Xu, the CEO of DoorDash. He is, I consider him sort of the decentralized interoperability guru. He is a logistics savant. He can take fragmented ecosystems and he can really build them up and rebuild them. Even look at something as simple as the routing mechanisms in the DoorDash application. That logic in and of itself put into healthcare could be life changing for scheduling capacity and billing workflow. So I think that's a place we should think about looking. It's not having a full understanding of healthcare that's going to win. It's really having a core understanding of how to solve the key problem. And if the problem is data structure and fragmented data, I think Tony's a good example of someone who's mastered it.
My first question for you, though, is you began your career outside of healthcare and then moved into the legal space before really finding your path in health tech. How did your early experiences in law and compliance really prepare you for the world of healthcare operations and the digital transformation that goes about it?
You know what? I kind of stumbled into healthcare from the legal sector. And I thought it was by accident, but I think it was meant to be because I genuinely believe that the rigorous backbone that you learn in legal to really be mindful of compliance in the regulatory landscape, it really prepares you to work in a highly regulated industry like healthcare, like finance, right? Healthcare is one of those spaces where innovation is outpacing the regulations at this point. Being able to sort of balance how the regulatory landscape is changing things and then influencing how companies are building is a necessity. I think also being in legal as a whole, it sharpens your pencil on details. You really focus on every single small detail, I think more than I do in healthcare. Bringing that into this space has been invaluable, and I think a lot of my colleagues over the years have noticed it. There's just a precision that we bring, having been in deals, been in contracts for so many hours, and it's something you just can't be taught.
Joining Amwell in its early days, you really helped scale a large proportion of the telehealth startup through, an IPO during major industry shift. And so what were the biggest lessons you learned about scaling operations during that time and, navigating rapid growth in digital health?
Yeah, this is a big one. And I'm going to say this twice. I'm going to make sure everybody hears this. Build for scale before you scale. Build for scale before you scale. I've worked with many clients over the last few years, and there's this interesting philosophy of create the problem to then justify the solution. That's a really delicate place to be. And I think that methodology can work in some spaces, but we're talking about healthcare. We're talking about patients and providers and care delivery. We can't afford to create that problem because there are real people on the other end of that problem. And if we don't solve it, we've put them in a really bad spot. So I am always, as an operator first, going to be pushing for build for scale before you scale. Certainly there are scenarios where that age-old building the plane while you're flying absolutely is necessary, but that should never be the norm. That should always be the exception.
I think that happens, quite often. Why do you think that's the case? And, what makes healthcare so unique that you have to follow this philosophy, as you mentioned?
Because every stakeholder in healthcare has one very important priority. And that very important priority is cost. Whether it's how much I'm spending or how much an insurance company is spending or how much a health system has in their budget, everyone's watching the dollars in the cents. And growth drives revenue. So we always push for the growth to drive the revenue, and then we focus on the ops after the fact. And so I've always been the proponent for really trying to run both of those those swim lanes in parallel, right? We can grow, but we can also build for scale at the same time. And that's really where I try to educate clients. Building for scale doesn't have to cost you a whole lot. It doesn't have to take a whole lot, depending on where you're at and what you're looking to do. But to just ignore it and focus solely on the growth, it's a big mistake, and I've never seen it play out well in practice. Once the mistake is made, it is very chaotic to address it, very costly to address it.
Tying, some of that operational experience after Amwell, you really helped build a virtual functional medical practice. And so when unique operational, regulatory, and reimbursement challenges kind of come about, what did you really face in bringing about the root cause and preventative care to the mainstream?
So this was like a passion project. The work that we did in this practice was incredible. These physicians were the most incredible group of physicians I've ever worked with, willing to help us fix the problems as well as delivering their clinical care. It really was truly an amazing effort. And what it came down to is we genuinely believed that access was key. Everyone should have access to any style of medicine, any specialty that they need. It's the tragedy of our system right now. It's hard to gain that access. And we truly believe, and to this day, that access is driven by cost, and insurance is the path toward access for most people living in the United States. And so we have to figure out how to make insurance work for us. That was the biggest problem. We were determined to get the insurance barriers brought down, but what that meant was we really had to embrace this hybrid care model where you have different products and services that are being offered, supplements, advanced lab testing, health coaching services, clinical services through doctors and mid-levels. You have to sort of navigate all of those different services and how to package it up in a way that people can consume. But then on the flip end, those clinical services, we had to find a way to get them reimbursed by the payers. Most of these services didn't have codes. They weren't being coded for. So we had to sort of be the early adopters that started the process of working with these payers to say, here's what we offer, and then figure out based on their rules, how can we back in to get the reimbursement. So it was a very creative strategy on sort of how to navigate the coding to ensure that we had the right margins on all the clinical services to stay afloat. And this is, frankly, I would argue this is what most small practices are struggling with when they start to think about flipping from fee-for-service into insurance model, is can they make up on the insurance end enough to keep them in a profitable space? The answer to that question is often no.
Yeah, that's the case. And I think on the flip side, right, the path to payer acceptance for innovative care can be very arduous. And so how have you learned to really translate those clinical outcomes and long-term value into language that insurers and investors actually understand?
You have to do just that. You have to literally frame it for your audience. We can't create one deck for all of our stakeholders. We probably are going to have 4 different decks. One for our internal teams to create alignment, one for our payer partners to create alignment, one for our other practice and referral partners, health systems to create alignment, and potentially even one for our providers. I think we often overlook providers because they're nested under practices and health systems, but the reality is the voice of the provider is so critically important because they're touching the EMR and the systems way more than the COO of their health system. So we can't overlook the provider there. And so when you're looking at sort of those different stakeholders, what's their currency? What's the thing that matters the most to them? What's the thing that motivates them to do their job? For our payer partners, it's reduction of care. So we need to talk to them in terms of PMs. We need to talk to them in terms of audit-ready documentation. We need to talk to them in terms of utilization shifts, major cost avoidances. For our investor friends, if we're a VC or PE-backed organization, we need to be making sure we surface things like TAM and CAC. These are things that health systems aren't thinking about, right? For our internal teams, we need to be highlighting them efficiency metrics, operations. And for our providers, we really need to be showing them that the changes that are being made are driving changes in their hours, their time commitments, and their workloads, but also their patients. And so I think it really drills down to framing your outcomes in economic terms for your investors and your insurers, and framing your quality outcomes specifically for your employees and your providers. And that's really what matters to get them to buy in. Say just one final thing with payers, it's not good enough to show them 1 or 2 milestone wins. They want to see consistency. They want to see the ability to repeat these data dashboards every single month and to be showing the either constant tracking or the progress. They don't want to see one-off wins. And when they see these dashboards consistently, it builds trust. They start to trust your data. They trust your operation. They trust how you're working. This is how you start negotiating for better rates. This is how you start talking about preferred partner status with payers if you want referrals, but really you have to get it down in their terms. And it's the practice's job, the owner of that data, to figure out who's my audience, what do they care about, and then serve it up that way.
That takes some real alignment. And I think you have some experience in that because I know you've led cross-functional teams really to be responsible for, that support, the training, the billing, and the clinical ops. And so within healthcare, what does it really take to have the keys to build a really high-performing and adaptable teams in some place that's fast-moving and a high-growth healthcare environment?
Yeah, I think we focus a lot on building the people, and I always try to focus on the systems and the processes first. We can go out and hire the best talent, but if we don't have the right systems and processes in place, or a vision to establish a system or process for that thing in place, we're bringing in people that are probably not going to be set up to be as successful as they could be. So it always starts with the systems and processes. I also think, again, alignment, and that's, I think, a word we're going to hear a lot over the next hour, is making sure that we're all on the same page about what we're trying to achieve, how we're going to measure it, how we're going to get there, when we're going to get there. Ambiguity is the fastest way to kill momentum in an organization. So clarity must be key for leaders. You have to lead with clarity. And then I'm also I think the other key piece for leaders, teaching your people early the importance of cross-functional collaboration and communication. We talk about it a lot in organizations, but I think really building it into the DNA of the culture at the top, establishing those relationships, looking at your cross-functional partners as part of your team, not just the people that are part of your domain, establishing pathways and rituals that really enable stronger communication across lines, sharing information across departments. What a concept, right? We only think about sharing data to leadership and to clients, but what if we share data with each other in terms that each other understood? Now we're really building that strong connective tissue inside the company, just like we're looking to build outside in the healthcare ecosystem.
The healthcare system is more fragmented and complex than ever, and is really affecting both patients and clinicians. And so, what do you see as the main drivers of burnout for physicians, and why is it so challenging to actually solve?
Again, this has nothing to do with the person. And I have so many physician friends, and they work so hard. They give it everything. And as hard as they work and as tired as they are, they just keep pushing. And thank goodness for all of us that they do. Their burnout is not a personal problem. It is a systemic problem. We have put them in a system that is failing them. Administrative and clerical burden on providers right now is the worst I've ever seen it. On average, providers are spending up to 2 hours on clerical and administrative work for every single hour of patient care they are delivering. That's a problem. And if any of us have been in a practice or worked in a practice, we see how we're stacking our providers back to back to back all day. Many of them going from 8 in the morning until 4 in the afternoon. That's 8 hours of patient-facing work right there. We've just also added 16 hours of admin work on top of that. Where does that go? It doesn't go anywhere. So I think that just spells the crux of the problem here. There are misaligned incentives. That is at the crux of the systemic problem. We have a system that is rewarding throughput, volume, speed instead of outcomes and quality. And physicians, many of my physician friends and colleagues, they went to medical school to heal people. They didn't go to school to have to ascertain how to operate between some of these ridiculous constraints. And so we're putting them in a really awkward position, and they're having to stretch in both ways to meet the regulatory and compliance needs, but then to also be able to feel good about themselves, knowing that they delivered top-notch patient quality care. It's not okay. So we're putting them in an emotional bind because they're torn every day from just wanting to focus on their families or self-care, but also take excellent care of their patients. That's something that's got to change. It's not okay. I mean, and then I think there's just this other piece that we don't talk about enough, and it's really the true loss of autonomy that a lot of our providers are feeling in the system right now. It is demoralizing to be as senior and seasoned and trained up as these providers are. They entered medicine to help, but they are getting cut off at every which way by payers and protocols and productivity metrics along the way. It is literally impeding their ability to exercise sound clinical judgment. So I think this is I'm passionate about this. I am not a physician. I don't even have a physician in my family, but I've worked in healthcare so long that I just see the invisible audience that we cannot ignore.
Speaking about that, there's a persistent gap between great technology and real interoperability. And so, why is connective tissue, as you've mentioned, so underrated in healthcare? And what does it take for startups and incumbents really to start working together for true scale?
Well, connective tissue is sort of the ops work. It's the stuff behind the curtain that nobody wants to talk about. It's not the glamorous stuff that's going to generate a lot of revenue. It's probably not even the stuff that you're going to put in a major press release, but it is foundational. There's no way around it. It is absolutely foundational to success, to scale, to high quality care. It's amazing when a health system launches Epic. They migrate off of their legacy system to Epic. A practice stands up their first EMR. These are all milestones we cheer for. That's not where the magic is. The magic isn't that you got a new shiny tool. The magic is that your new shiny tool talks to all the other tools the way that it's supposed to. And those tools talk to other tools outside. That's really where the magic is. That magic isn't happening right now. So that's kind of where I think we have some opportunity. The connective tissue is really integration. It's something we don't want to really discuss, whether it's a procedural integration or a technical integration. We launch something and then we set it and forget it. That is sort of my experience working in practices. And we need to do a better job of circling the wagons back around to the full ecosystem and figuring out where we've left holes. It's Swiss cheese. Where are the holes? And then starting to kind of tackle each of those holes, because what's happening in practices and health systems today, clients I work with today, we're just putting people on these holes. Instead of fixing the hole the right way because we don't have time, we don't have money, we're quite literally just putting people on the problems. And we're cutting back left and right to lean out as best we can. So we're trying to collapse roles. And what's ending up happening is the quality of care and the quality of the patient experience is plummeting. So I guess that's sort of my spiel on that.
Many startups, face a frustratingly slow path when it comes down to pilot to real integration, as you mentioned, whether it be technical or procedural. And this is partially due to structural incentives and partially due to the culture environment. And so from your experience, what are the top misconceptions founders have about breaking into health systems and payer networks?
So I think a lot of founders, I have worked with a lot of folks, founders and executives alike. The payer space is still very much a black box to a lot of people. And that's okay. This isn't a new phenomenon, but the more individuals that I work with, the more I start to find the simple things like understanding the complexity or how long it takes. These are things we sort of have to start from ground zero on. We have to say standard payer contract, if you want to go in network, 90 days, maybe longer. That doesn't even include credentialing, which could be another 90 days. So right there, you're already looking at 6 months. So I think a lot of people, their jaws drop when they hear some of these timelines because they think that you can just spin up an insurance arm like that, and it's just not how the industry works. It's not how insurers work. It's not. I will also say for founders that want to break into healthcare as a whole, I would say that it's less about the problems that have to be solved. And it's really more about understanding the ecosystem and being that translator, like we talked about, right? Really understanding all the players and then knowing how to connect those dots together. Because right now we have a lot of amazing players in each of their specific domains, but these players are not coming out of their domains to actually connect from entity to entity to entity. We need more people that can do just that. It doesn't require a true healthcare experience. It's a different type of skill set. I think it's highly driven on EQ. I think these are salespeople, these are deals people who build relationships and bring the right people in for the right discussions. Then the magic starts. Then we can start talking about attacking those actual problems. But step one, we have to get the right people in the room.
Curious to note, when you're talking about actually breaking into these systems, these different networks, particularly when it comes down to payer networks, there's an ability of you want to move fast, but how do you move fast while also paying respect to those timelines, as you mentioned, that, it can already take 6 months to just build?
That's a really good question, and it's one that we've had to tackle at a couple of different practices we've worked in. So there's sort of two-pronged approach we can take. If they're really, really interested in getting their feet wet in insurance, we can consider an out-of-network option. Right? You don't have to go through the full contracting or credentialing process. We can absolutely submit out-of-network claims as long as we have a robust communication strategy for our patients. Operationally, we understand the nuts and bolts of what we need to do to actually get the out-of-network claim submitted on behalf of our patients, whether it's we have the patients submitting through Reimbursify, which is an excellent application that I would recommend, whether we do it on their behalf through the tool or whether we submit through our own EMR. There's options that we can do. That's one way to get your feet wet in insurance while you're waiting for your first few contracts to come through. It starts to share immediate benefit to some of your patient base. So that's a win. The second thing that I always recommend doing is once you sort of have your priority list of contracts that you're going for, you can start to go through the process of developing your checklist already of the things that you're going to need, documentation you're going to have in place, workflow changes that may be necessary due to some of the restraints that they may have, starting to work with your engineering teams to figure out what does your tech stack need, your EMR and other things to actually support a new payer as it's coming in. There's a lot of different things that you can be doing. You can also build your payer playbook. Start with your payer playbook. That's something I just did for a client. They were a little bit further along in their insurance journey, but I always say that you should be building the playbook before you start the contracting because the contracting is part of the playbook. How we repeat the contracting, the things that we're putting in our payer scorecard, those are all things that you can build right into your playbook. So those 3 months of waiting, it's waiting for those in-network contracts, but you can still be hitting the ground on out-of-network contracts and you can still be getting your documentation in place so that when those contracts hit, you're shortening the timeline before you can actually go live.
You are about, data-driven strategy. And so what does it take for early stage companies to win over those payers? And what kind of outcomes, dashboards, or analytics truly move the needle in negotiations to become fully aligned?
It's a good one. And it's very similar to what we were talking about, knowing your audience. So we know what payers care about. The biggest thing payers are going to be looking at is risk reduction. That is their job. That is their actual, by definition, job, is to reduce the risk of its members. So we sort of have to figure out how to frame innovation through the lens of risk reduction and using the dashboards to prove it and then using the outcomes to justify it, right? And so things that they're going to want to be looking at, most of the HEDIS metrics here are going to matter. ER visits, readmissions rates, no-shows and cancellation rates by the patient itself, total cost of care back by claims that are going out. And then in the dashboards, and this is what I was saying earlier, we need to make sure that we dashboard and we share with them regularly. Just because they don't ask for it doesn't mean that we shouldn't be showing it to them. The more consistently we show them the data and the more consistently the data gets better and better and better, the stronger case we're going to have for ongoing negotiations and for those preferred statuses. So in the dashboard, we want to track things like PMPM savings, denial avoidances, network adequacy lifts. The focus, again, always staying on financial and operational value to the payer through their courtesy. While quality matters, they want to know how well we're serving their patients. A PSAT score is going to go a long way. Really what they're looking at, are we compliant with HEDIS metrics, and are we able to actually show the cost avoidance and things like readmission rates and, actually staying compliant in their plan, not canceling their appointments with us. That's a good way to show that we're avoiding other costs down the line because they're staying compliant on their plan, they're staying out of the hospital, and they're in outpatient care, which is much, much cheaper.
What advice do you have for, new founders navigating that slow pace and, structural barriers of healthcare really to, as you mentioned, reduce risk, but also when it comes down to business terms, increase revenue and the value. So around these partnerships, reimbursement and regulatory requirements that are around.
So healthcare I don't see it changing anytime soon. It's a long game. So any founder that wants to play in healthcare, just be ready for the long game here. I think there's huge wins, but it is a game of patience. Nothing happens quickly, but you can get short wins. And that's really what keeps a lot of us staying the course is we know that the long goal is decades away, but there's short wins we can be getting every quarter to continuously chip away at that goal, right? I think for new founders, I've heard a lot of people saying, and I've even been, someone who says this, that healthcare is broken. And as I've reflected on that, it's not that it's broken, it's just that it's really complex. It's a level of complex that maybe we can't define. It's really, really complicated. And so founders who are going to do well in this space, again, don't have to be healthcare masters. They have to be people who define their own success on being a fearless disruptor and on being that interpreter of the situation, of the room, to being the savvy bridge builders across these really disparate channels, who can take really that bird's eye view on the entire ecosystem and say, these two need to talk more. There's friction here. There needs to be a third party brought in here, right? We don't have anyone that's doing that because right now we're all affiliated with our own organizations, which is sort of the travesty that we're living in. The other thing that I would say to any founder is relationships matter. And I think you know that. I think all of us know that's common sense. With payers, we can show them all the data we want, but the reality is we need to make sure that we're also spending time nurturing those relationships. That doesn't mean you have to play tennis with the CEO of UHC. It just means that you have to find other ways to capture their attention, right? Maybe you do have someone in your network that can get you a conversation with a director in the credentialing department. It's not a bad idea to try to have that dialogue just as an intro. As I said, proactively surfacing your dashboards and your data without being prompted, that's a standout thing. Being willing and brave enough to share that data with payers, it does go a long way, but it may be a long game you're playing. You may have to do that for 6, 12 months before you get traction, but it's the consistency, it's the repeatability, and it's the progress that you're showing. So that's part of the relationship building, and that's why I say it is a long game.
Background like yours, bridging law, business, and operations, how do you see cross-disciplinary skills shaping the next generation of healthcare founders and leaders?
I've said it before, and I'm going to continue to lean on it. I think the next generation of leaders in this space, anyone can be taught operations. Anyone can be taught finance. We all learn these classes in college and high school. I don't think these are unique skill sets by any means. I think some of us are just better at them than others, and some people like to do them more than others. The piece about healthcare, which may be true in any industry, but I think it's special in healthcare, is it is a deeply human industry. We're not talking about people's finances right now. We're not talking about education right now. We're not talking about buying a new car right now. We're talking about people's lives. And there's that human component. And so that's where leaders with high EQs will do very well in this space because there's a lot of different personalities that need to be navigated, a lot of different very challenging historical circumstances that all of us are sort of delicately trying to tiptoe around. We need people who can come in a very thoughtful and respectful way to start shaking the trees a little bit and helping to get all of us together. And I think that you can't teach EQ. You can't learn it through exposure. And I think there are some people that have had more relevant exposures than others that will perform better in this area. But I can't underscore the importance of that skill just in being able to communicate, collaborate, build trust, build relationships, longevity, retention. These are all things that matter in healthcare. If you have a high EQ, a lot of the other tactical things can be taught along the way, except probably the clinical care. If you're not a doctor, we're not going to teach you how to doctor. But everything else in healthcare, you can be taught how to do.
Those that want to get, a higher exposure, where would you maybe recommend for them to go?
Well, so there's core functions that you're going to find in any healthcare company. You're going to find your sales, your marketing arms. You're going to find your back-end operations arm, some sort of tech arm, even if it's a single engineer who's managing your entire ecosystem. Really, the more you can touch every area of the business, the better you will be at thinking about the broader ecosystem. Because if we stay insulated into one small domain in one organization, we're so far removed from the entire healthcare system. So that's why I think the first place people can start is expand your strengths, your understanding, and your awareness of your entire business to the extent that the business allows you to do so. And once you sort of felt like, if you feel as though you've flexed your arms as far as you can in your current company, that gives you an opportunity to start looking outwards, to start gaining more exposure, maybe building some networks, start joining some payer circles, maybe some small groups with small payers and starting to get your feet wet on that end. Maybe you want to join a small RCM group, a small billing group that just talks about claims all day long. But there's ways to kind of start to get more exposure. But first place to start is your current organization. If you're working in healthcare, touch as many parts of it as you can, because then you'll really start to see all of the holes in the Swiss cheese and where you want to start focusing your efforts.
Yeah, I know you've advocated for bringing talent and insights from industries outside of healthcare. And so, what fresh perspectives or approaches do you wish more health tech teams would borrow from other sectors, if you can name them, to really accelerate impact?
So many of our friends are doing it so well. We have a lot of healthcare products, and I think that they're excellent, but they're all very disparate. And sometimes we under index the value of the UX. And I think tech and SaaS companies do it quite well. So I would like to see they have an iteration speed unlike anything you're going to see in healthcare. They also truly understand the concept of product market fit. And while that may not be as relevant a concept in healthcare, the services we deliver, one could argue, are products, and they need a PMF before you can take them out into the world. And so I think taking a note on general design and iteration from product and SaaS companies or tech and SaaS companies is a first place I'd start. I would also delve into hospitality a little bit, because when we think about patient care, we think about patient-centered care. It should be all about the patient. And yet, as a patient, many of us sometimes don't always feel like it's all about us. We feel like we're a cog in a wheel. We need to take some lessons from some of our hospitality partners. I mean, I've never stayed in a Ritz-Carlton, but for anyone who has, maybe you had your coffee spilled on you and it ruined your blouse. But there's probably a lot of other bells and whistles you had in that experience that made it feel really top-notch, even though that one bad thing happened. Imagine if healthcare was similar, if we could bring more of those bells and whistles along. I think that's a good spot. And then last but not least, logistics firms and fintech have always set the standard. And in fact, I've taken many notes from them on playbooks and how to develop automated workflows, scalable workflows, repeatable workflows.
Those things that you mentioned are things I'm looking into. So I'm glad that you were able to bring that to the audience. But my last question for you before moving on to the lightning round is really looking ahead, what keeps you optimistic about fixing healthcare's most persistent pain points? And where do you hope to see the most meaningful change in the next decade? Because this is a situation, and if maybe we want to put it, a battle that is very day to day.
It's true. There's so much focus right now. Like if you looked at anyone's top 20 list, it's changing by the hour. I think there's a lot of good stuff happening in healthcare today, which does keep me feeling optimistic. Like I said, we have a lot of good technologies and a lot of up and coming health tech startups that are doing incredible things. So that always makes me feel good. I think watching those wonderful innovations actually drive impact and outcomes is where I think we're stalling a little bit. And we need a couple of wins to sort of reinvigorate our whole population going into end of year. I think the two places where there's the biggest opportunity for improvement, and I actually think one of them is a core dependency for improvements across the board, and that is I'm really pushing for seamless data exchanges across our EHRs, across our payers, and across our care teams. That ability to stitch together our data in a more integrated way is life-changing for every single player in the healthcare space. And it is, in fact, it is a dependency for so many other core pieces of innovation that could come in the healthcare space. So I'd start there and say that's, without question, the first place we need to move in. I would say not even in the next 10 years, in the next 2 to 5. And then second, moving to a value-based payment system. I think that structure on the payer end would be incredible for us. It would reward prevention as well as standard procedures, but it really helps us to better design a model that is both primary and preventative instead of just preventative, which is sort of how we're operating today. And for value-based care structures to work, I would go back to my initial ask. Seamless data exchange is an absolute necessity for that to work without pushing the administrative burden down on our providers and our admins. So those would be the two places I would want to focus my efforts.
Okay, Monica, it is time for the lightning round. And so my first question for you is, what's the most underrated skill healthcare operators need to succeed in today's fragmented system, as we just discussed?
Still going to come down to those soft skills, empathy, contextual empathy, I think specifically. The key to addressing a lot of the challenges we are seeing right now in healthcare is being able to connect the disparate parts. And that means knowing your audience, reading the room, understanding what each stakeholder values, and then tailoring the communication and the strategy accordingly. Payers, providers, patients, they all want very different things from our system. They all look at success and failure very differently, and they all feel the pain points and the wins differently. And so individuals who can sort of parse those things out, tease out the things that are relevant by stakeholder, and then surfacing them at the relevant times are going to be the people that win the race.
My next question for you is, what's the biggest barrier preventing the healthcare connective tissue, as you mentioned, from actually coming together as it should?
So it's kind of, I look at it sort of like an analogy of a family trying to get out the door to go do an activity, go apple picking, we'll say. Mom and dad have their own motivators, their own drivers, their own things that are causing them the anxieties. The children have their own things that they want to be doing, their own things that are going to motivate them. If we collectively can't all get on the same page and aligned in what we're doing, where we're going, and when we're going, we're not getting there. Or we're going to get there and it's going to be total chaos. And it's going to be a lot of meltdowns and a lot of friction that just doesn't need to be in place. And so the sooner that we can start to bridge these gaps and better align incentives across all of the different players, the better off we're going to be, because now we're all speaking the same language. When I say that, I mean health systems who are focusing on financial sustainability and margin and compliance, alongside payers who are worried about cost containment and risk management and member retention. And then you stack that against providers who actually have to deliver the care, and they're trying to focus on their own clinical autonomy while optimizing their workflows as prescribed by their employers, as well as delivering top-notch patient care. And then the last stakeholder is all of us who are patients in this system. We want affordable, timely care that's convenient, right? So those are all really important things. And it's not to say that any of these stakeholders isn't entitled to or doesn't deserve to get the things that they would like. But how do we get to a common ground where we can find a way to make some of these work together, where all of us are measured against it, all of us are interested in it, and all of us are marching toward it? Until we get there, we're all really just running around in circles in different directions, chasing different objectives. I think it all starts with the incentives, making sure we're on the same page there, and then the systems and the processes flow from there.
One of my last questions for you is, what's one operational or regulatory win in your career that gave you a real hope for the future of health tech?
So growth is a big topic in healthcare, specifically when we think about practices. There's a lot of up-and-coming practices, virtual and brick and mortar, that are really trying to make a name for themselves in the healthcare space. Part of that growth means expansion, and part of expansion means really having to deal with the regulatory challenges of moving state by state. And we haven't talked too much about that, but anyone who sort of works in a highly regulated space that is trying to operate outside of just one standalone state can tell you that it gets very complicated very quickly. And so in my prior lives, I have had quite a bit of experience in multi-state expansion, including a credentialing engine that really allows not just for the practice to get moved into another state or states plural, and tough states, California, Texas, Florida, the bigs, right? We move the practice into the state, but then we've also developed a credentialing arm that really allows us to cut the onboarding time. And in some cases, we can get it down by about 40%. And that's a matter of a month. That's a long amount of time. That's the amount of time from application to practicing. So that's substantial. But what was the big win in that wasn't that we were able to stand it up. It's that the payers honored it. The payers respected it. So that is like one step in the right direction, where we're starting to find that we can get to common ground between practice A and payer, as it relates to one small component of healthcare, which is getting contracted and getting credentialed, so we can get patients in front of we can get providers in front of patients. So there's a glimmer of hope there, but again, every payer is a special snowflake. So just because it works with one doesn't mean that it's going to work with all.
Absolutely. And my last question for you is, what does it take to do the boring work in healthcare, really to get the right type of outcomes and the good goals that people want?
There's a lot of boring work in healthcare. And that may be an unpopular statement. I'm not afraid of the boring work. And I think a lot of operators in this space are not afraid of the boring work. It's something that we accept as part of the role. I look at the boring work as an enabler of the big wins at the end. If we want that big, massive change, a system integration, a procedural change at the CMS level, a rate increase at the payer level, you name it, there's a lot of boring stuff that's going to have to go into it. And so the boring work, it's an enabler. If it doesn't get done, then that big thing doesn't get done. And if I want that thing bad enough, the boring work's going to get done. I also find that many other operators that I work with in healthcare are of like minds. Once we understand what the end goal is, and it's often the long game in healthcare, you come into this knowing you're probably going to play a long game. Then you just got to latch onto those incrementals, the shorter term wins to kind of keep you staying the course until you achieve the objective. And you just stay the course until you achieve the objective. It's a mindset, but it is boring, but it's necessary.
Well, Monica, thank you for your time and your thoughts. I think we spoke a lot about, what it takes to be operationally successful in healthcare. But what are some final thoughts that you might have for the audience?
Healthcare is a tough sector to work in, but it's certainly not for the faint of heart. But I don't think you don't have to come from healthcare if you want to join healthcare. Healthcare, our system has so many different challenges and opportunities that it's going to take an army, and it's going to take a lot of different perspectives to get us there. And so I always caution people not to weed yourselves out without healthcare experience. I came into healthcare without healthcare experience, so it is possible. And if you're anything like me, it's going to take you in, and it's going to just grab you and hold you, and it's not going to let you go. And you just become you become very enmeshed in the space, and it's become a lifelong passion project of mine to do any and everything I can to reshape the healthcare system. I have children, and I want my children to have a functional, efficient, cost-effective, high-quality system that can support them when they're adults.
I love that. As I mentioned, it's all about the personal well-being and empowering that for patients, for people across the world. So I love that. Now, my final thing is, where can people connect with you if they choose to do so?
You can find me on LinkedIn, and you can also find me through one of the agencies I advise through directly is Sprout Healthcare. And so you can find me through there, but always available on LinkedIn and through my email too. I'm always open to have email inquiries. I want to talk to anyone. I'm an open book, and as we were just chatting, I love to set up networking calls that are sort of brain breaks outside of the day job for any of us. It's sometimes nice to just sit down and connect with people in the space that just either want to talk about nothing or talk about everything or one specific challenge and see if we can get to some sort of solutioning state.
Well, Monica, thank you for your time on the K in Clarity podcast.
Thank you. It's been a pleasure.